one or two. Okay, so it happens when you probably evaluation visit first visit. If it's a soft tissue area is a little bit flabby and then it's you are expecting you don't want to have too much pressure there, then your tray material should be light body, not medium body or monophase. Okay, if it's very firm, this area is very firm and it's not going to have too much pressure, then you can use the medium or monophase. But if you're expecting, okay, I prefer to use light body even on the tray for the partial impression. So you have to really know patient mouth, soft soft tissue also. Okay, so if that is the plan, you have to make tray on your framework. Okay, draw a line. Okay, 2 millimeters shorter from the the length area, so you have a room for the photo molding both area. Okay, and then you sit the framework into the cast, and then you apply try it. Okay, and this is how I did. Make sure you have to tuck it in a little bit so this try and staying, not wobbly or falls out. Okay, tuck it in slightly because you have to remove it after you pour up. Okay, so and then you trim nicely any rough area, and then you do the bottom of the only this distal extension area. This is with the PPS heavy body. And if your faculty decide, okay, let's use a compound because the patient is all over and there's saliva there and then tongue is used, you don't know it's going to be interfering too much, then maybe compound will be easier. Then this is impression. So the photo molding with the compound. Okay. So after impression is done, impression is only those two saddles. Okay, when you make impression, okay, load the tray in the posterior area and sit into the patient mouth. You're holding it with your finger. Where you're putting it, where rest, or the anterior area right here, the where the against the hard tissue means teeth. Okay, if you put your finger pressure into the distal area, that won't be good impression. Okay, means if you're gonna push it in the posterior area, you're gonna have a space in the anterior area that will causing a problem when you're processing it, and distal will not fit when you insert. Okay, so when you make impression or doing bottom molding, make sure you don't put your finger in distal area. Okay, when impression is done, you're cutting right that finish line area with the scalpel. Okay, because you have to beading and boxing right this area only, not up here. Okay, so when you have impression done, do not try put it back to your master cast, please. Okay, it's not gonna go back to your master cast. Okay, you have to deport it. So stop when you have a make impression, leave it out. Okay, now let's dismiss patient. You're gonna fill out the progress note. Okay, so when this is a scenario 3, framework trying but was not fitting well, so you need to do the corrected cast impression. Okay, so means okay, you tried in, okay, adjusted and occlusal contact adjust the one arch at a time and together, and evaluation of a framework fitting well intraorally and the same as on the cast around the hard tissue, and means it fits well around the teeth, right? But it's not the same on the soft tissue distal extension as it is on cast. Means that indication of corrected cast impression. That's the one thing as a dentist you should be able to tell, do I need corrected cast impression or not? That's the only one thing you really have to check when you try it. Okay. So you did corrected cast impression made with the PBS. Okay, bottom molding with the heavy body and wash impression with the light body. So when you're done, I will tell you how to do the lab work, but when next visit, we're gonna start over with the metal framework trying in. Okay, so you're gonna repeat what you did today. Okay, so now you have to prepare something different. Okay, after you dismiss patient, your faculty will sign off your work authorization sheet to, cutting out for the distal area. Okay, that's the reason I told you not to put it back to master cast because it's not fitting in the distal extension area. That's why you made another impression, right? So bring it to the removable lab. We have a machine here, okay? And then the Nicole will give you back with this 3 pieces, okay? So this one, the right side, left side, that's garbage, okay? Now you can put it back because this area, hard tissue area, fitting well still, exactly same as in intraorally, right? Now you're gonna do the beading and boxing, distal extension area, okay? This is what you look, you can see, and then you do beading and boxing, posterior area, and pour up. If you wanna see the different color, you can pour up with the microstone in the distal extension area. But this time I put with the the J stone, so you cannot tell, but the pour is up here. Okay, so now you ready to take a trine, metal framework trine again. Okay, so do you have any question?
I have a question with the lingual plate. When you
Okay.
there's like diastemas, and you have to, I guess, kind of cut it to not show the diastemas. If the patient has mobility in their lower teeth, does that add pressure to mobility?
Well, okay. That's why the abutment still has a rest prep, even if you're doing plating, right? Even if you plate, I see a lot of common mistake. Some people do not even make a rest because they saying it's a plate. You need a vertical stop of your rest.
Okay.
Okay. So if it already have a mobility, the framework, okay, will not give more pressure. If there's a mobility anterior incisors, I intentionally do plate instead of a lingual bar. If your framework is a lingual bar, we cannot even repair. We cannot add a tooth into the framework. So if it's periodontally involved, plate them, okay? And your question was one was step back. They should have enough room because the inferior border of the plate, okay, should be reaching floor of the mouth, so it should be have enough room there, okay. If you have a plate, if you lose that tooth, still no problem to repair it because the plate goes up, okay. And I don't expecting too much pressure into that tooth because stop, there's no rest on those teeth.
Okay.
Thank you.
Hi, Dr.
Anybody else?
Hi, Dr. Kim. I also had a question. I don't know if you already talked about this in your lecture, but I was just wondering, so what was the reason of us doing the corrected cast impression? Did we not record the posterior edentulous distal extension correctly in the first place?
Well, can be several reasons, okay. Probably too much pressure in the soft tissue, okay. A lot of people, distal extension area very flabby, then you should not use the material, heavy body or medium body. Instead of those, probably use light body. That'll relieve the pressure a lot more, right? But when you make impression, if you use the medium body, okay, then probably had the pressure that can cause that the discrepancy, between the intraorally and the cast. Old days, when we didn't have a PBS material, they made all other impression and fabricate the framework, and they make just the distal corrected cast impression routinely. But since we're using PBS, we don't have to do routinely. Just you have to know intraoral condition and material what you're using. So if you're doing properly, shouldn't happen. I don't expect.
I see. So you said that previously we used to use other materials. So what materials were those, Dr. Kim? I mean, this is not PV. That was not.
Okay, when we didn't have the PBS material, they made the impression for the RPD with the RJ. Okay, and
Okay.
hard tissue, teeth area, prep that area, all fine, right? So they fabricate framework first, and then distal extension area, they use like a rubber base, or that's they used to use it, but we don't use that anymore. As I mentioned to you, the impression material, you have to pull up right away. It's not as accurate as PBS, so actually we get rid of that. So we don't use that anymore. Even if the PBS is more expensive, but you are going to use this material, not all the material anymore. Okay, so the material change a lot of the steps we don't have to do.
Right. I get your point. Thank you.
You're welcome. Anybody? Okay. Thank you. Have good luck for the midterm exam next week, and I'll see you February 25th. Okay.
Thank you, Dr.
Have a
Kim.
good